Hi friends. Uh, Now let us discuss about another important 5 marker question, that is selective estrogen receptor modulators. Selective estrogen receptor modulators. Okay, let's see what does these selective estrogen receptor modulators include. It includes tamoxifen, raloxifene, or meloxifene. Okay, Uh, okay, we have it is also called as SERMS in short. It has the tissue selective actions and estrogen like actions in some, and also estrogen antagonistic action in other tissues. Means it plays a double role, like it acts both estrogen like actions as well as estrogen antagonistic actions. Okay, let us see or study individual group among this. Okay, the first thing we are going to study is tamoxifen. As we know, it has both estrogenic action and anti-estrogenic action. Now let us think, or now let us see what does this action refers to. First of all, this tamoxifen, it is a non-steroidal compound. It has selective ER modulating effect. Fine. Let us see what anti-estrogenic action it can be done. Anti-estrogenic action, it does on two things, on the breast cancer cells as well as the peripheral sites. In the breast cancer cells, it reduces the tumor size, as well as in the peripheral sites, it causes hot flushes. Then coming to the estrogenic action, estrogen basically acts on endometrium. On the endometrium, it causes endometrial proliferation. On the bone, it causes anti-resorptive effect. Usually, bone absorption will be there, but when we give this tamoxifen, there will be anti-resorption. On the plasma lipid, it reduces the cholesterol and LDL levels. We know that LDL is known as bad cholesterol. Since this level decreases, it also reduces the cardiac dysfunction or cardiac related side effects. Okay, now let us see in what tissues what does it cause. Basically on the uterus, it causes endometrial proliferation. In the bone, it decreases the rate of resorption by inhibiting the activity of osteoclast. Basically, in the bone, there are cells called osteoblast and osteoclast. This tamoxifen selectively act on the osteoclast to decrease the rate of reabsorption. Then plasma lipids, we know LDL is bad cholesterol. It reduces the LDL levels and it decrease the risk of cardiovascular disease. Okay, fine. We learnt about the actions of tamoxifen. Now let us see the pharmacokinetics. What happens? Tamoxifen, it is well absorbed on oral administration. तो पैसा बच गया. Metabolized in liver, excreted into the gut via bile, undergoes enterohepatic cycling. Here we need to see something. It is metabolized in liver as well as undergoes enterohepatic cycling. Okay, सबसे पहले ना इसका यूजेस के बारे में देख लेते हैं. Let's see what's the uses of tamoxifen. It is used orally in carcinoma of breast, as we seen above. We can notice that it reduces the tumor size. So it can be used in carcinoma of breast. Then, and also it can be used as both premenopausal and postmenopausal. Okay, it can be used in both premenopausal and postmenopausal women. There is no rule that premenopausal women should be taken or postmenopausal women should be taken. Okay, by the way, now let us see what are the adverse effect. सबसे पहले ना all oral pills have this famous side adverse effect, that is nausea, vomiting. Then other side effect, we have seen that hot flashes, increased risk of endometrial crosses and venous thrombosis. Why endometrial cancer? Because the estrogenic effect of this drug is in the endometrium, it causes endometrial proliferation. So because of this, it might causes endometrial cancer. Then venous thrombosis, as we all know, it also acts on the plasma lipid. This might causes the venous thrombosis. Okay friends, now let us go to second group. It is raloxifene. Raloxifene has high affinity for both ER alpha, ER beta. Okay, let us see what this raloxifene does. It has high affinity. Since it has high affinity, it also has both anti-estrogenic action as well as estrogenic action. But here the things changes. It has the anti-estrogenic action on breast. There tamoxifen has the anti-estrogenic action on the breast, but not on the endometrium. Here it acts on the endometrium. So here we need to remember raloxifene. Raloxifene acts on breast and endometrium. Let's see what happens in the West. Anti-proliferative effect on ER positive breast tumors. So here anti-proliferation. In the endometrium, there is no endometrial proliferation. So it is a positive thing to be noted. There in the tamoxifen, there was endometrial proliferation, but here there is no endometrial proliferation. So the chances of the endometrial cancer might be reduced. Fine. Now let us see the estrogenic action. Estrogenic action, here we see the bone. Here anti-resorptive effect is more and hence reduces the risk of vertebral fractures. When there is reabsorption, then the calcium level of the bone decreases. Since there is anti-reabsorption effect, it prevents the fractures. Then as usual, in the plasma lipid, reduces the cholesterol and LDL levels. Since there is less LDL level, less cardiogenic side effects. But in blood, increases the risk of venous thrombosis. This is to be noted. Friends, each and every drug has its own uses as well as adverse effect. We need to treat accordingly by looking at the condition of the patient carefully. So now let us proceed further. The pharmacokinetics. Okay. Raloxifene is rapidly absorbed after oral administration. See, it is rapidly absorbed, but it has a side effect, that is poor bioavailability due to extensive first pass metabolism. There it has a good bioavailability, but here it has extensive first pass metabolism, and it is used for prevention and treatment of osteoporosis in post-menopausal women. This is to be noted. That was given by both pre and post-menopausal. Here it is given for the treatment of osteoporosis in post-menopausal women. The adverse effect, मान लो यहाँ पे adverse effect ऊपर क्या देखे थे? On the venous circulation, it might cause deep vein thrombosis. So here we can see the chances of deep vein thrombosis as well as pulmonary embolism. It does not increases the risk of endometrial cancer because here it shows anti-proliferative effect on the endometrium. Then one more drug is there. Now we need one more drug among this group is ormeloxifene. Ormeloxifene is also selective estrogen receptor modulator. SERM. Ormeloxifene. यहाँ पे it has antagonistic effect on breast and uterus. There we saw agonistic effect. antagonistic effect on both breast and uterus. Since it has both antagonistic effect, it is useful for the treatment of dysfunctional uterine bleeding. Okay, since it in uterus, it treats the dysfunctional uterine bleeding. Adverse effect common headache, nausea, and weight gain. This is only used for treating breast and uterus. Okay, friends, this is one of the important 5-marker question. Selective estrogen receptor modulator. It is done. We will meet in the next video. Thank you.